So who do we have next? Up next is the Swades Foundation, founded by Ronnie and Zarina Skrubala, who run a very, very unique 360-degree transformation program across education, health, water, sanitation, livelihoods. And this also makes them a very natural fit for other scalable programs that they do really well. So when we visited, we found that they do really well integrating into their education program. They have Maluste participating with them, and they do really well working with other programs. We have Antara and them now having conversations, and that's a key part of what the 360-degree program does. And they work in their module. And the program that we've picked to talk about today is their iCare model, right? Their iCare program, yes. And Mangesh, the CEO, will talk about this. And what really struck us is they've taken what the IT sector does. So IT products to scale, you have to create a tiered help desk system, right? So low-level issues were kind of dealt with by the low-level call center person. But if something became complicated, you had a very, very expensive resource. But then you manage that expensive resources time by making sure all issues that got escalated use their time wisely. Otherwise, your IT help desk would run at a loss. So to run an integrated system at low cost, you have to run a supply chain in the IT world like that. And what Swades did, they said, hey, why can't we apply that in eye care? And that's what they're going to talk about here. And not just eye care, they've now started to take that model to other very, very important areas like cardiac, etc. So moderating this discussion is Nandan. Nandan is another founding member of IIT-IIT, and we're pleased to have him on our global advisory board. He's been very, very instrumental in helping us. He's very much part of the boards of lots of social impact organizations, and currently is the Secretary and Treasurer of Mumbai First, trying to push a number of things in Mumbai as well. So we will get to the video and then Nandan, over to you.
Well, first of all, I think I'd like to thank Karthik and Joe for putting together a great program. Isn't it a great program?
Yes.
And thank you for inviting me to do this. Mangesh, why don't we both sit actually? I thought that was a very impressive video, but I'm not sure we all got the scale of this. Swades seems to make most of the working in Raigad, which of course is just across the water from Bombay. Can you tell us a little bit more about Raigad and why did you choose to be there?
Sure. Good evening, everyone. Am I audible?
Yes.
So, Raigad district, if you look on various data and indicators, may not. Raigad district, if you really look on various parameters, may not appear very low on HDI because of Panvel and because of kind of industrial commercial areas. But if you go block by block, the 7 blocks where we are working, the population is in poverty. About 40% of households where we work, more than even like 11,000 households. Annual household income is less than 50,000 per annum. Another 1/3 households have annual household income between 50,000 to 2 lakh. And 15% tribal population, and it is hilly area, the services are very difficult to deliver. So there is a very big need, and unlike many geographies like Palghar, just to say, this area is not penetrated by NGO work. And there is a big need, big gap, so that was one reason we were.
That's surprising, being so close to Mumbai and yet not penetrated by NGOs, HDI is still quite low. So that's a revelation. But now tell us about the eye care. You know, when we think about development, I don't think most of us think about eye care first. Although obviously, for humans to be functional, having good eyesight is obviously valuable. Can you tell us a little bit about how that happened and what kind of impact, how many people in that area are there, how many of them have issues with vision?
Sure. So our goal, if you see, we have mentioned 1 million people to be impacted every 5 to 6 years. In these 6 blocks, now you heard in the 7th block which we started last month. So the data which I am referring to is largely for 6 blocks where we entered first. The total population is about 4,71,000 and about 28% of them have either fully migrated or partly migrated. So active population is around 3.5, about 3.7 lakh of people in this geography. And as per our model, and if you see the data also, 1% of prevalence is there in population for blindness. 75% is avoidable causes, cataract and so the goal which we had set out for us is how we can make our geography totally free of blind problem. So we have reached out to more than 2.7 lakh the population, the data we have showed. We have screened all these individuals through schools, through communities, door to door. And we have found this situation where 67,000 refractive errors have been identified, 55,000 spectacles have been given. We were able to identify more than 22,000 patients for cataract surgery. And what you have seen, and the number is, as on date stands, about 11,700 cataract surgeries we have done. So the remaining, another 11,000 you can take, are those people who have either not come for the surgery through us, they have done on their own, which is about 15% is our sense. But remaining cases are due to either diabetes or hypertension or other medical conditions, they could not be operated. Maybe we were late to reach out to them. But still we have done more than 11,700 surgeries.
And covered 2.7
Yes.
lakh people in
and
the bulk.
across 2,000 hamlets or villages, 354 gram panchayats in a contiguous geography.
So would you say you pretty much covered the whole population?
Almost another, I think, 6 to 8 months we would have screened entire population. That is our goal. The March, April, we want to complete this.
Perfect. So, again, somebody earlier spoke about the fact, I think Jamal mentioned that, the fact that India is so vast. So over here, you're saying you're going to cover 1 million people every 5 to 6 years, which in itself is a staggeringly large figure, but of course in the context of 1.3 billion it's not so huge. But secondly, I think Joe mentioned the idea of 360 degrees development. And yet, what we've chosen to showcase today is eye care. Now, the way I'm seeing it, what's exciting about what we've done in eye care is found a way, as Joe was putting it, to have a hierarchy. So the most expensive resources are required the least. This, of course, will be done in other programs elsewhere. But overall, therefore, the cost is modest. Can you first of all give us some sense of what is modest? What kind of per head cost are you talking about for 2.7 or 3.5 lakh people?
Yeah, so this program started somewhere in 2013-14, and the numbers which we have covered. The total cost is about 4.5 to 5 crores we have incurred, and this brings to about 200 rupees to 250 rupees per person if I divide on entire population.
Per year?
Yes, to make this geography cataract free, if I say, or blind, to avoid this blindness problem. So that is a cost to really to screen entire population, reach out to them, provide their services, and of course our partners have played a great role in helping us achieve this.
So about 200 rupees per year per person gives you insurance against poor eyesight, which is a pretty good deal, right? And what kinds of partners have helped you with this?
Yeah, so in case of, if you say implementation partner, Lakshmi Charitable Trust, both trustees are there, Dr. Indupur and Dr. Nandan both are there. And they have been really working. So for us, our philosophy is to work with best of the partners because the kind of programs that we have, no compromise on that. So we are rest assured that this side we don't have to worry. Actually, this side Pune is another partner. In terms of donors, UTI-AMC is one of the biggest supporters in this program. Rotary and Red Cross, they have provided us with vans. So this is how they got us support.
Perfect. And so, having developed this method of, as you call it, tri-aging, where you discover the right level of engagement for each patient, for each person in the population, you're going to expand this, right? You're going to take this to healthcare in other areas. Can you tell us about that?
Yeah, so one of the things which you must have seen from the video is Swades Mitra, and that is the primary level of screening. And that is something which has given us a huge power to really make this model to really deliver not just the quality but also at cost and at very good speed. So we have tried this model also for cardiac. We do a big cardiac program for congenital heart disease. And last year while setting up our target, vegetarian, Ronnie said what kind of line listing we have. So our team had some list of about 40-50 line listing which we had got from government. But the question which Ronnie raised, can you guarantee there is no child which has been left out and we have in such situation? And the team started thinking through this, how we can be sure that we have 100% line listing done and no child is left. So our team figured out Swades Mitra is something which we can leverage this, and we did almost 8 to 10 meetings to reach out to these 800 plus Swades Mitras, reached out to government people also, and Asha and Anganwadi. Gave them 4 or 5 basic symptoms to really look at. In 4 to 5 weeks, we got a list of about 200 kids with potential to really, and we took them for testing. We bought 100 cases which were requiring some kind of cardiac intervention. About 47 to 48 who needed surgery. So see the power, the speed, immediately we got government line listing was much lower, listing system has worked. Another area which we are looking is anemia eradication. Again with government of Maharashtra, we have MOU for anemia eradication. Because of our education program, we have reached in 806 Anganwadis and 1240 plus schools and more than 1,25,000 kids. Now, imagine if these kids have to be tested and then treated. One is a regular method system where we can take years to really first diagnose, and we have more than 45-48% of anemia cases. So they need immediate identification and treatment. Again, through involving community health and Asha Anganwadi, we can make it much faster and scale at much lower cost.
Great. And how does this fit into the rest of your 360-degree program?
Yeah, so believe in Swades right from day one. There is no single bullet to solve our problems. It has to be 360-degree model. I can solve water problem today and sanitation problem today, but if I don't look at education again. So let me give you an example about education, how our work in education helped and strengthened this program. So earlier we were used to we were working only with communities in villages. We never reached out to schools. And 2 years back, when we revisited our program, and this program was on education and inclusive education. And during this inclusive education program, when we were reaching out to schools, we realized there were issues with vision for the kids. And we started implementing this program in schools, and the van started visiting there, screening started happening. And these numbers include those kids also. But we have done, besides this, 122 surgeries for children with special needs, only around eye care. Besides, of course, giving spectacles and reflective.
Okay. So finally, what happens next, and what can people in this room do to help you make it happen?
Okay, first of all, when we call Swades, our belief is so se bane desh. And I think earlier speakers also have mentioned community has to be at the center, and we have to really look at that as a very important aspect. Everything we have to design around the community. So our model is very clearly based on this belief that community is at the center. We have to listen and work with them. And we have kind of Zarina keeps saying that let us have some Swades app, because we are very open and we are very willing to collaborate. You've seen our implementation, we work with partners, rest of the partners. So one thing is definitely how we can collaborate and get best of the technology, which we realized while implementing eye-care program. We could have used technology to do a lot of digitization and a lot of paperwork, the numbers we have seen. So that is one learning we definitely got. We are working on a document to capture our learnings across all our thematic area 360. And if this document can be loaded on app, and one is technology part but also entire architecture and design. So anybody who wants to take this in any village, they can just experience our learning, apply to the local context because needs and challenges are different, but principles can be there. And in terms of our thinking, our thought process, there are three key principles we follow. First is alignment of purpose. I think that is very important. In this room, I'll really look forward, as a Swadesh would look forward, that alignment of purpose is primary thing. Then principles of engagement is second key, how we will engage. And third is alignment of processes, that is the third P. This 3P is important. And of course, any form of support through not just knowledge but also through donations will help us expand. Because we have added one more geography last month, one more block, which is 30% travel. Again, it is closer to Mumbai. You cross Imagika, Sudhagar block starts, Pali. And the kind of, like for us in the eye opener, the kind of challenges we are seeing, it is hardly 2 hours from Mumbai. And nobody has touched that. Our team is finding difficulty to find places to stay. But yes, it is a good challenge, good problem to solve, and any partner in any form will be very happy to receive that.
Great, Mangesh. Thanks so much.
Thank you much.